Imagine lying in a hospital bed, unable to eat, speak, or move, while machines beep tirelessly in sync with your heartbeat. This is the harsh reality for many patients in intensive care units across the globe. Amidst this critical environment, where each moment holds the weight of a life, the simple act of feeding transforms into a complex science of survival. Enteral feeding, often overlooked in casual conversations about healthcare, emerges as a lifeline, delicately balancing the fragile strings of life in the ICU. Enteral feeding is a nutritional delivery method that allows healthcare professionals to provide critical nutrients directly to a patient's gastrointestinal tract, bypassing the usual process of eating and swallowing. This approach is not only about sustaining life, but also about enhancing the body's natural healing processes, preventing infections, and improving overall recovery rates in critically ill patients. In the ICU, where patients often face severe metabolic stress, the choice of nutritional strategy is pivotal. Enteral nutrition supports gut integrity and reduces the risks of bacterial translocation and subsequent infections. It also plays a crucial role in modulating the immune response, helping the body to combat the multifaceted challenges it faces during critical illness. Making the decision to use enteral feeding involves a complex assessment of the patient's condition, including factors such as the stability of the gastrointestinal tract, the presence of complications like sepsis or multi-organ failure, and the specific nutritional needs dictated by their medical condition and recovery trajectory. Physicians and dietitians work collaboratively to tailor nutrient compositions that meet the exact needs of each individual, a process that underscores the bespoke nature of modern medical care. The effectiveness of enteral feeding is significant, but it is not devoid of challenges. The risk of aspiration, tube dislocation, or infections are real complications that require vigilant management. Teams in the ICU are trained to handle these issues swiftly to prevent further distress or harm to the patient. John, a 58-year-old male, suffered a severe stroke that left him in a comatose state, unable to swallow or respond. His medical team decided to initiate enteral feeding 2 days post-admission to prevent nutritional deficits, which could exacerbate his condition. Over the weeks, John's nutritional regimen was carefully adjusted in response to his changing metabolic demands, which played a crucial role in his slow, yet significant recovery. This case exemplifies the critical role of timely and precise nutritional intervention in recovery trajectories for severe neurological conditions. Another scenario involves Maria, a 45-year-old patient who developed severe pancreatitis and was at high risk of infections and other complications. The medical team opted for an immune-modulating feed, which includes agents such as arginine and omega-3 fatty acids, known to enhance immune function and reduce inflammatory responses. Her recovery, while protracted, was aided significantly by these targeted nutritional interventions, demonstrating the therapeutic potential of enteral feeding beyond mere sustenance. The above examples illustrate not only the diversity and applications of enteral feeding, but also highlight the critical thinking and decision-making involved in ICU nutritional management. Clinical teams must continually balance the benefits of enteral nutrition against potential complications, adapting their strategies to the evolving needs of patients. The ongoing research in enteral nutrition promises to refine these approaches further. Recent studies have been exploring the optimal timing and composition of feeds to maximize benefits and minimize complications. These advancements are crucial in enhancing patient outcomes and are testament to the dynamic nature of ICU care, constantly evolving to meet the demands of medical science and human need. In conclusion, enteral feeding in the ICU represents a vital aspect of modern medical care, exemplifying how a deep understanding of nutrition can significantly influence recovery in critical illness. The stories of John, Maria, and countless others highlight not just the science, but also the profoundly human aspect of this life-saving intervention. Through meticulous research and compassionate application, this form of medical nutrition continues to save lives and restore health, bearing out the old saying that sometimes an ounce of prevention is worth a pound of cure. Video designed by Emeris Biotech for Public Awareness Program, Thanks for watching.